Now, many practices have access to ultrasound machines, but echoing cats is challenging. It can be quite difficult to restrain cats adequately for echocardiography, and it can also be difficult to obtain the standard views and also to interpret them. And so we'll show you some of the tricks for being able to obtain views and the very important views. So if you have an ultrasound machine in your practice, then you have the means to obtain some really useful information. So here we have an unsedated cat, and the number one most important thing is to avoid stressing the cat. So using gentle restraint, here we're just clipping off a little bit of hair coat, which will make it easier for you to obtain good images. So you will need to use a lot of ultrasound gel, and this will help you get close contact with the skin. All the time it's important that we cause as little stress as possible to the cat. So you'll need to orientate the probe so that you obtain a short axis view at the level of the left atrium and aorta. Don't worry about obtaining a good view of any of the ventricles. You just need to know about the size of the left atrium. This takes a bit of practice, even if you've done ultrasound before, but the value of having an image of the left atrium is so great that, believe me, it's really worth practicing. It's important that you have a basic understanding of the machine controls, gain, depth, selecting the appropriate frequency to optimize your image. The advantage of an ultrasound examination is that you get instant information on the size of the left atrium, and so whether or not the cat is at high risk of developing congestive failure or thromboembolism. You can also obtain images in lateral recumbency if you have a table that has an appropriate cutout. Again, you need to restrain the cat very carefully, and it's important that the underneath leg is pushed forwards by pushing it above the elbow. Again, you need to use plenty of ultrasound gel. And often the images are a little better in lateral recumbency because the lowermost lung tends to collapse and you get better images with less air interference. Either method is fine, whichever the cat and you prefer. So if you don't use the echo for anything else, you'll want to use it to measure the left atrium. That's the key thing that we want to be able to identify. So the left atrium normally, in a short axis view, should be less than 1.5 times the diameter of the aorta. And if you have a normal size left atrium, you can be more confident that a cat is at low risk for developing thromboembolism or congestive heart failure. Not all cats with left atrial enlargement inevitably develop problems. Some of them will go on for quite long periods of time, even years, without developing problems, but those cats are certainly higher risk. And you can look on either a short axis view or on a long axis view. On long axis views, the left atrium tends to become rounder, whereas a normal left atrium is usually more square-shaped. So having a rounded left atrium on a long axis view would be a sign of potentially of an enlarged left atrium. And if you want a precise diagnosis of the specific type of cardiomyopathy, you probably need to consider referring to a specialist cardiologist, because echocardiography of cats is certainly challenging, and you can see that the different types of cardiomyopathy can be quite difficult to differentiate. So there's always the option for a more detailed echo scan if you refer.